Next topic is anemia. It is nothing but low HB levels. In male, normal is 14 to 16 gram per deciliter. In female, normal HB levels are 12 to 16 gram per deciliter. So when it drops below this lower limit, in this range, it is said to be anemia. Now, the common causes in India for anemia is iron deficiency, folic acid deficiency, vitamin B12 deficiency. So, or it could be erythropoiesis is not that effective, and it could be secondary to many causes, like secondary to infection, anemia of chronic disease, secondary to inflammation and bone marrow disorders. And also it could also be due to blood loss, which leads to the deficiency. There could be increased destruction of these RBCs also, like in thalassemia. How does the patient present? We already know that it is symptoms, say tiredness, weakness, and when you examine the patient, the nails, tongue look pale. So in other pallor, so the patient will have pallor, and depending on the cause of this anemia, like for iron deficiency, when you go through blood investigations, there could be low MCV. For iron deficiency anemia, MCV could be low, but for folic acid or B12 deficiency, MCV could be high. So normal MCV is also shown in the primary bone marrow disorders, renal failure, hemolysis. But having the other investigations in hand, we should be able to come to a diagnosis. A bone marrow biopsy or aspiration is done when the anemia does not respond to therapy even after 4 weeks. So at that time you can also do bone marrow examination. Now coming to the treatment part, we will go to the treatment. Treatment in women, it could also be menorrhagia. In other people, it could be GI blood loss. So it could be hookworm infestation, dietary deficiency. So knowing the main source of this problem, main cause of this issue is very important. So we'll start with ferrous sulfate, 200 mg 3 times a day. Okay. So when the hemoglobin starts increasing, say it goes over 10 gram per deciliter, you start reducing this dose of ferrous sulfate. Once the hemoglobin is normal, you will have to continue 1 tablet per day for at least 3 months. If there is a folic acid deficiency, so we can also be given tablet folic acid 5 mg daily. So even if it is in malabsorption syndrome, this dose is adequate. Next will be B12 deficiency. So B12 deficiency is very common in vegetarians. So how much will you be giving? It could be tablet vitamin B complex, okay, or injection B12 1000 microgram IM, okay, IM. 1 injection on alternate days, total 5 injections, okay. Then after this, you will be administering this injection once a week for 5 weeks again. After this, you will be administering the same injection once in 3 to 6 months. Okay, so that was B12 administration. With all this, do not miss explaining it to the patient that iron should be taken after food, because if it is taken before food, it could produce stomach upset. and the stools turn black when on iron therapy. All these things have to be explained properly to the patient. So that was about anemia. Thank you.